Yes, I agree. Knowledge is power, and nothing beats experience. Of course, hands-on experience you can't beat. However, when I was new to the ICU, I would write down every single thing throughout my shift that I was unsure of or wanted to look up. And when I would get home, I would research it. So that way, when I went back to my next shift, I could keep learning and growing. I already knew that information that I looked up, and I could be a smarter, better ICU nurse. Nothing ever beats hands-on experience, but I wish I had like a quick guide, a quick crash course to the ICU, because I was so overwhelmed when I started. I was so anxious, I was so nervous, and every shift I would go home and feel just like, like defeated. And so many new ICU nurses feel this way. It's a normal feeling to a certain extent, but I wish there was like a resource for me that kind of could help get me up to speed on some of the most common ICU practices. Ventilators, drips, arterial lines, central lines, hemodynamics, intubating a patient, how to talk to families about death and dying. I had to just learn all that on the spot. No one really could teach me that until I was there. And obviously it all worked out, but there's a lot of nurses who feel so overwhelmed and defeated that they leave the ICU because of this anxiety, because they're so scared. So that is why I developed my ICU crash course. I wanted to help new ICU nurses feel empowered and confident, and like they had a good resource to get them up to speed on the most, the basic things of the ICU that a lot of us have just had to learn at the bedside without kind of having that little one up. I don't think it's a bad thing to, have this extra education and knowledge. I think it's a wonderful thing, and I wanted to be that person to create it for other people. I truly love educating other nurses and growing other nurses, and I never want someone to leave the bedside because they just feel so overwhelmed by the amount of education and amount of knowledge that they have to learn going into the ICU. So that's why I created my ICU crash course. It's linked in my bio if you're interested. You get 3 CEUs with it, and I love it. It's like my little baby, and I know you guys are going to love it too.